Now that the national state of disaster has been terminated, the Health Ministry plans to introduce changes to the National Health Act. It's aimed in part at managing the pandemic. The draft health regulations have been published for public comment, which close on the 16th of April. Deputy Health Minister, that is, of course, Dr. Sibongiseni Dhlomo, joins us now to discuss this with us. And Deputy Minister, thank you so much for your time this morning. I suppose the big question is, how will then the regulations transition from, national state of disaster now under the National Health Act? How are you, of course, handling and managing that transition?
Good morning to Marian. Good morning to your viewers. You would recall that, yes, you are correctly putting it, the state of disaster has ended on the 5th of April. On that night before, the president therefore announced that there are certain regulations that will remain, however, just to assist us in this transitional period before the gazetted regulations of health will then kick in up to the 16th of April, where we are still waiting for comments. So there is that transitional period now of recovery and rehabilitation, where there are about 5 of those that were in the state of disaster that have remained, just to assist us to control the situation until our regulations are as part of the Health Act, yes.
Yeah. DM, what's the response to the likes of Dear SA campaign, the likes of Solidarity, who have taken government to court previously, I know, just under the national state of disaster, to be scrapped? So that is done. It's now officially ended. But I spoke to Rob Hutchinson this morning, and he says they will continue with their legal bid in court against you as a department, because moving the regulations to the National Health Act means that the regulations will continue indefinitely on a more permanent basis, even though they are of the view that the disaster has ended. How do you respond as government to that?
Look, our document, which has then since been gazetted, our regulations that we want to put in there, have also gone through the state law advisor to actually indicate as to whether we are anyway breaching any constitutional processes for the country or for the individuals. That has not come into our space. I hope that then when we get into court with their papers, we'll be able to indicate that we would need some control, some way of managing. Look, if we have had these regulations of how to manage pandemics like this one, we don't have needed the state of disaster. Now that we are putting those regulations in place, we hope that it will take care of what are the prerequisites of the Minister of Health in the event there's a disaster in the country. He needs to really be empowered in terms of that. So that is all what we are going through, and that's all what we are bringing into force.
And also you're emphasizing public commentary, that deadline being the 16th of April. How important is it to get the views of the public in this regard?
We really encourage our South Africans to come forward, indicate. We're not saying our regulations are cast in stone. There may be here and there where we need to amend, listen to their comments and take forward or respond appropriately why we would have to keep those ones in the way they are. So we are really keenly waiting, and we are seeing some of them are coming through. There's still more time for South Africans. Please educate us, comment, and then we'll take those into consideration as we then make the final sort of document into the Health Act as the regulations actually around this medical challenge that we do face in the world.
Right. I'm sure, DM, you have seen some comments, at least from, religious groups not satisfied with some of the regulations. They're saying that it goes against the constitution of, free will and choice that South Africans have to make when it comes to, either being vaccinated, producing a vaccine certificate, especially for, coming to places of worship or even in small gatherings. There seems to be a lot of concerns raised there by at least that group. There's at least a particular group that we all know publicly has shared their views, with some of the regulations. What's your response as the health department to religious groups who seem to be resistant to some of your recommendations?
Yeah, we do note that contentious point with religious groups, but we are actually welcoming the comments that are coming in from the sports fraternity that says that we welcome what you are saying. Indoor, we still wear mask. Outdoor, no mask. 50% of our venues. Look at that. FNB Stadium, you can now take an easily 40,000 out of that 80,000. 40,000 can go in there. But of course, there's a big cooperation from that sector to say we will want people only who are vaccinated to come through. We will insist and work around that. Now, we are saying to the religious leadership, we may not be having this 50% permanently, but we are actually getting advices. Why don't we err on the side of accepting this process going forward? And then as things improve, some of the countries are not wearing masks anymore. And the vaccination issues, we are saying it may as well be possible in the next few months if we get a majority of our South Africans vaccinating. And we are right now, we are very pleased with the majority of the 50 years and above. They are vaccinated up to 68%, 70%, which is quite good. Now, there is still a big challenge with the 18-year-old to 34 years old. They are vaccinated up to 35%. We wish to push that much higher, and then we might just have no reason, therefore, to keep some of the regulations towards the end of the year, I hope.
Right. And besides, of course, religious groups, there's also FEDASA, on the other hand, Deputy Minister. I'm sure you're aware that they've been protesting and obviously sharing their views and, you know, asking and pleading for the removal of the PCR test requirement for unvaccinated children between the age of 5 and 12. They're saying this is damaging inbound family travel to South Africa and further hindering South African families from traveling. What's the response then to the likes of FEDASA in this regard?
Look, we will collate all that and then look into that, but we are also guided by scientists. We also look into the international trend, what happens in other countries. It's not just us. I mean, some of the South Africans would complain and raise those issues, but probably don't if they travel, because it's not us who are actually making some of the, is the in-country where they are going to that will also be dictating what they would like to see the citizens coming into the country. We have our own. We will probably look into that. I'm not very much aware and familiar with that deep presentation, but I'm sure they will look into that and comment in response to what they are actually raising.
All right. Well, of course, I think the important message as well here, Deputy Minister, is that all South Africans should go through, of course, these gazetted regulations, public comments, very much encouraged. 16th of April being the deadline. And I'm sure as the Health Department, you'll consider all those comments and, of course, to get back to us in terms of what that decision is under the National Health Act. But DM, as usual, thank you so much for joining me this morning and making time for us. That's the Deputy Health Minister, Dr. Sibongiseni Dhlomo.